Assalamu alaikum everyone. My name is Bakhtawar Shahzad and I will be teaching you general anatomy. And over today's lecture is basically about the introduction of the anatomy, and we will learn some very basic terminologies that will help you when you will study anatomy. So starting with the meaning of anatomy, it's basically to cut up. Ana means up and to means to cut. So we basically uh, learn the structure and function of the body structures after cutting them up. So these are the disciplines of the anatomy. The microscopic anatomy is basically when you want to look at the structure and you can uh, study that structure without any instrument. That means you do not need any instrument to study that structure, and this is also called gross anatomy. The next one is the microscopic or histological anatomy, and in this you need some aid. That means you would need an instrument or the microscope to study the structure, and you basically study the tissues and cells of the structure in the microscopic anatomy. Next is the developmental anatomy, and this is basically related to the lifetime structural changes, not only during the intrauterine life but also in the postnatal life. The next one is the neuroanatomy, and this is the study of the brain. This is the definition of anatomy, and anatomy is the science of structure and function of the body, and I have already told you about the meaning of anatomy. Ana means anatome, that in which the ana means up and tome means to cut. Okay, next we have some other types of anatomy. The basic anatomy is the study of the minimal amount of anatomy consistent with the understanding of the overall structure and function of the body, while the clinical anatomy is the study of the macroscopic structure and function of the body as it relates to the practice of medicine and other health sciences. In the approach to the study of gross anatomy, in the regional anatomy, we basically divide our body in different regions and we study them region wise. For example, we divide our body into upper limb, lower limb, the abdomen, and the pelvic region, and in thorax as well. So we can very easily study the body region wise. In the systemic anatomy, we divide the body into the systems and then we study them system wise. For example, our body has been divided into different systems, and we can study the cardiovascular system that is related to the heart and the circulatory system. Similarly, we can study the respiratory system that is related to the lungs and the bronchioles. You are already familiar with the organization of the human body, and you know that the smallest living unit of the body is the cell, and when the cells work together in a group, they are called tissue. Next is the organ, and an organ is a structure which is composed of several different tissues performing a particular function, and organs work together as systems. Okay, now this is really very important, and now we will study some basic anatomical terms. As you know that human can move, so we basically have a reference position that gives meaning to the directional terms used to describe the body parts and regions. So basically the purpose of this anatomical nomenclature is to describe the areas of the body and to provide the orientation when describing the parts of the human anatomy and to distinguish different movements of the body. When we will study the musculoskeletal system, then we will study the movements as well. But before that, I will like to highlight some very basic terminologies. Okay, as I have said that we being human, we can move and we can change the position. So we have a reference position that gives the meaning to the directional terms. Okay, so this is the anatomical position, this one here, the image A. So as you can see that the body is in the erect position. Erect means the person is standing up. So the body is in the erect position. His arms are at his sides and his palms are facing forward. His feet are also facing forward and his head is also pointing forward. So this is the anatomical position. Remember, this is very important. The body should be in the erect or standing position. The head, eyes and toes should be directed forward. The arms or limbs should be at the sides of the body and the direction of the palms should be facing forward. And this is the anatomical position. Okay, now we will learn about the term prone and supine. Okay, so when the body is lying face down in the anatomical position, this is called the prone position. In our language, हम इसे कहते हैं कि उल्टा लेट जाना. So when you are lying down on your belly with your face down and your back up, we call this position the prone position. And when the body is lying with the face up, this is called the supine position. And this is a standard position, I think, जिसे हम कहते हैं कि सीधे लेटना. Okay, now we will study about the anatomical planes. And it's basically similar when you are cutting a bread loaf. Okay, now you really need to concentrate what I am saying. Basically हम अपनी बॉडी को different planes में cut करते हैं and then we look at the structures of the body from different positions. For example, अगर आपके पास एक object है, for example there is a car and you are looking at it from its front side and you can also look at it from the lateral side. For example, आपके पास different angles हैं जिनसे आप उस कार को देख सकते हैं. Similarly, आपकी body को भी different planes से cut किया जाता है, different planes में cut किया जाता है and we look at the structures differently in different planes. मैंने आपको bread के loaf की example दी है. You slice your bread loaf. ठीक है, जब आप उसको slice कर रहे होते हैं, you make different slices. You are cutting the bread loaf into a superior and inferior half. Okay, so similarly, when you divide your body like this into two equal halves, a right half and a left half, then this plane is called the mid-sagittal plane or the median plane. Once again, you are cutting your body like this, that your body has been cut into two equal halves, in a right and in a left half. Okay, you can see in this picture clearly. आप अपनी बॉडी को इस तरह से कट कर रहे हैं फ्रॉम द मिड लाइन दैट हाफ्स शुड बी इक्वल. ठीक है, ऐसे नहीं होना चाहिए कि एक साइड पे आपका ज़्यादा हाफ हो गया है और दूसरी साइड पे आपका कम हाफ हो गया. सो व्हेन यू आर डूइंग or cutting the body like this, then this plane is called the median plane or the mid-sagittal plane, and this is also called vertical plane. So the vertical plane, the median plane or mid-sagittal plane, passes through the center of the body, and it divides the body into two equal halves, a right and a left half. Now this is the paramedian plane, and you can see that this plane is parallel to the median plane, the one that we studied before. This was the median plane, and you can see that the plane is passing from the center and cutting the body into two equal halves, while in the paramedian plane you can see that the paramedian plane is parallel to the median plane, and although it is dividing the body into halves, but it is not dividing the body into two equal halves. Okay, so the vertical is parallel to the median plane, although it does divide the body into right and left half, but it does not equally divide the body into equal halves. Next is the coronal plane, and now look at the plane. You can see that now the body is going to be divided into a front half and a back half, right? You can clearly see प्लेन इस तरह से गुजरा है और इस तरह से आपकी बॉडी को डिवाइड करा है कि आपकी बॉडी फ्रंट हाफ में डिवाइड होगी और बैक हाफ में डिवाइड होगी. And this plane is perpendicular to the median plane. So the point to remember here is that this plane is separating the body into interior and posterior parts. So we can use the term interior for the front side and the posterior for the back side as well. All you need is to keep these images in mind so that it gets easier for you to learn. Next you have is a horizontal plane, and here जो मैंने आपको bread loaf की example दी थी, that fits here, right? That's how you cut your bread. इस तरह से आप अपनी ब्रेड को कट करते हैं कि वो एक superior half में कट होती है और एक inferior half में, like उसका half part is above and half part is below. So similarly a horizontal plane slices your body like this, that half of the body is superiorly divided and half of it is inferiorly divided. But you can take the section from anywhere. Like if you want to study your abdomen, for example, you can take the section at any level. आप वो section intestine के level पे ले सकते हैं, आप वो section liver के level पे ले सकते हैं, आप वो section किसी भी structural level पे ले सकते हैं जो कि आपकी study की requirement है. So this plane is parallel to the floor and perpendicular to the median and coronal plane, and this divides or separates the body into superior and inferior parts. And another important point to remember is that the horizontal plane is also called transverse plane or axial plane. Okay, so once again we are going to revise our planes. So the plane that will divide your body into two equal halves, into two right and left equal halves. A plane that will pass through the center of the body or to the midline of your body, and it will cut your body like this, that your body has been divided into two equal halves, in a right half and a left half. Then such plane will be called mid-sagittal or medial plane. While a plane that will although divide your body into right and left half, but that wouldn't be equal halves, such plane will be called Paramedian plane, because that's parallel to the median plane. Then we studied about the Chronal plane as well. In this image they have shown the Chronal plane, and in the Chronal plane you can see that the body is being divided into front and the back part. And this one is the transverse or the horizontal plane, and we are cutting the body like this, that the body is being divided into superior and inferior parts. Okay, now we are going to study some more anatomical terminologies related to the position. So there is a term that is ventral or interior. So जो आपकी palmar face होती है, as we have discussed earlier about the anatomical position, so we started that the palmar surface will be facing forward, ठीक है? So that would be our interior surface or our interior part or the ventral as well. हम इसको ventral भी कह सकते हैं. The dorsal will be the side जो कि आपकी hand की back side होती है, that would be the dorsal side of your hand, or the posterior. So we can interchangeably use these terminologies. We can use the ventral for interior, and we can use dorsal for posterior. Next we have cephalic or superior. So the cephalic or superior means more towards the head, ठीक है? Any structure that is lying above or that is more towards the head side, that would be cephalic or superior, and the structure that would be more towards your feet away from the head, that would be caudal or inferior. So remember that cephalic, superior or upper, these are the same, or caudal, inferior or lower are the same. Okay, next we have middle, medius or intermediate. These can also be used interchangeably. So the middle means a structure that is more towards the midline of your body. So now you know about the midline. जो आपकी spine है, that is a midline structure, right? So any structure that is towards the midline of the body, we will call that middle structure, right? हम अगर relations में structures को use कर रहे हैं, तो हम इस तरह से describe करेंगे that this structure is medial to that structure. Okay. Next we have is the superficial deep. Okay, superficial is basically related to the surface of your body. So that's a structure that is more towards the surface of your body is superficial, and the deep, that is more inside, that would be the deeper structure. Next terms are the proximal and distal. These basically are used for the joints, okay? And proximal means the joint root. For example, the origin, the proximal part of your joint. For example, जो आपका arm है, the proximal part of your arm is your shoulder side, right? जो आपकी shoulder वाली side है, that is the proximal part of your arm. Okay, next we have is the distal. and distal is the end of your joint. So for example, मैंने जैसे आपको arm की example दी, the proximal part of your humerus or the arm was the shoulder side, and the distal part will be your of the arm will be the elbow side. Okay, now we have some other terms, and these are ipsilateral and contralateral. Ipsilateral means same side of the body, and contralateral means opposite side of the body. For example, अगर आपके पास patient आया है and he has requested you for an ultrasound or x-ray of ipsilateral किडनी, फॉर एग्ज़ाम्पल उसको जिस साइड पे पेन है उसी साइड की उसने किडनी की स्कैनिंग की रिक्वेस्ट की है, एंड द कॉन्ट्रालैटरल साइड विल बी द ऑपोजिट किडनी जिसमें उसको पेन नहीं हो रही, राइट. सो दीज आर द टर्मिनोलॉजीज. नेक्स्ट वी हैव द एक्सटर्नल एंड इंटरनल, एंड अ स्ट्रक्चर दैट इज़ बेसिकली हम होलो स्ट्रक्चर्स के लिए यूज़ करते हैं. फॉर एग्जांपल the vessels and the esophagus or trachea. So these are basically related to the layers, and you know that our arteries, vessels are composed of different layers. So जो आपके पास outermost layer होगी that would be external, and the one that is innermost we will call that internal layer. Okay. So next we have are the medial and lateral. You might won't be familiar with the names of the bones, and that's why मैं इसको अभी फ़िलहाल डिस्कस नहीं करूँगी, but you should be remember about the medial and lateral. That medial is more towards the midline of the body, and lateral is when a structure is away from the body. Okay, so here we have some images regarding these terminologies. So if we talk about the anterior term, and I have already told you that interior and ventral have same meaning and we can use them interchangeably. So just remember that a structure that is interiorly, that means that it is closer to the interior surface of the body, and on the other hand, if a structure is lying posteriorly, that means that it is closer to the posterior surface of the body. And because the coronal plane divides your body into a front half or interior half and a posterior half, so we will keep that in as a reference point. So here you can see that your thoracic cavity or the diaphragm or your abdominopelvic cavity, this is more anteriorly or towards the interior surface of the body, so we can call them ventral cavities. While the cranial cavity or the vertebral canal, as you can see that your vertebral column is more posteriorly, so the structures related to that are the dorsal cavities. Okay, so superior, as we have already discussed, will be a structure that is closer to the head, and inferior will be a structure that is closer to the feet. And the reference point is the horizontal plane or the transverse plane that we have already studied, and we know that a horizontal plane will divide your body into superior and inferior half. So the axial skeleton is superiorly and the appendicular structure skeleton or your lower limb is inferiorly. Okay, so superficial deep, and we know that the surface of the body is a reference point here. So a structure that is more towards the surface of the body, that would be superficial. For example, your skin is a superficial structure, and a deep structure will be that structure जो कि deeply lying कर रहा है. And for example, we have muscles and bones that are deeper structures. Next terminologies are proximal, and I have already told you that proximal and distal terms are basically used for the joints. Proximal will be closer to the root of the limbs. और मैंने इसमें आपको arm की example दी, and I told you that the proximal side will be this shoulder side, and the distal side will be the end of the arm, which is at the elbow joint. Okay, so the reference point in this regard is the origin of a structure. External or internal, which refers to a hollow structure, external being outside and internal being inside. And in this case मैंने आपको vessels की example दी, and I've told you that the vessels, as you know, are the hollow structures. So the vessels are composed of different layers. So a layer that would be more externally lying, we will call that external layer, and a layer that would be covering the vessel or the lining of the vessel, the innermost lining of the vessel is the internal layer. So next we have the medial and lateral terms. मैंने आपको बताया है that this is the midline of your body. So a structure that is more towards the midline of your body, that would be medial structure, and a structure that is more laterally oriented, we will, or away from the midline, we will call that lateral structure. Okay, so now here we will do some questions. So the terms posterior, ipsilateral and supine mean, we know that posterior के लिए we can use another term which is dorsal, and ipsilateral means same side of the body, and spine means lying on the back. The all other options are incorrect, so the right option is fourth one. Posterior, dorsal, ipsilateral, same side, and spine means lying on the back, and your face will be facing upward. The anatomical plane that divides the body into equal right and left half is the median plane. Why the first and all other options are incorrect? Because horizontal plane divides your body into upper and lower half, or superior and inferior half. The transverse plane is same as horizontal. The sagittal plane divides the body into two halves, but those halves won't be equal. And the coronal plane, we know that the coronal plane divides the body into anterior and posterior halves. So the right option was median plane, because they asked about a plane that will divide the body into two equal right and left halves. Next question is, the word caudal is a directional term that indicates towards the head end of the body, away from the head, towards the midline of the body, away from the midline of the body. So the right option is B, which is away from the head, because structure that would be towards the head, we will call that structure um, cephalic or cranial, while a structure that is away from the head, that would be caudal, or a structure that is more towards the feet. Okay, next we have the next question is that the hand is located at the dash end of the forearm. Okay, so we know that the forearm will end at the origin of your hand. So the hand will be located at the distal end of the forearm. The proximal or end or the origin of your forearm will be the elbow side, and the distal end of your forearm will be uh, the origin of your hand. So the hand is located at the distal end of the forearm. The coronal plane runs dash dividing the body or any of its part into interior and posterior portion. So we know that the right option is B, from front to back. The coronal plane runs from front to back and it divides the parts into interior and posterior portions. So that's all for today. And if you have any question regarding this lecture, you can definitely ask. Thank you so much.